News desk on Joy News. Now, some workers of the National Labour Commission have locked up the offices of the commission, demanding the removal of their chairman and the executive secretary. The workers are protesting over the termination of the appointment of their local union chairman and other officers and what they describe as appalling conditions of service. They petitioned the Flagstaff House about their grievances last Monday, but they say the last straw that broke the camel's back was the termination of the appointment of some of their colleagues. Joy News' Maxwell Agwagba has been speaking to a senior industrial relations officer at the NLC.
It started just yesterday when some employees were terminated. And so the appointments were terminated. So in reaction to that, the workers decided that, look, we are also going to sit down in solidarity of our staff who have been terminated. So that's why they have locked up this place. Okay. Well, the chairman, we've had issues with our current chairman, who used to be the former executive secretary. So we petitioned to the Ministry of Employment and Labor somewhere 2004, 2014, sorry. Okay. Then attempts were made, a committee was set up, and then they listened to us. Till date, there hasn't been, the outcome of the committee has not been communicated to us. He managed to bring this new executive secretary, and what he's doing is to hunt those who champion the petition that was sent to the ministry against his chairmanship. So, well, after that, he tried to transfer some of the employees who championed this to Takrade.
So, wait, who are we talking about here? Who are you accusing of witch hunting?
The chairman, Edward Broku-Bodu, is behind all these things. And he is using the current executive secretary, Charles Adonko Bawadia, to champion his interests by way of frustrating some of us and also transfer some of these things. And all these things are going on. We've had issues. We've written a letter to the presidency just 3 days ago. But the outcome is that some of us have been terminated.
Earlier, you mentioned to me that the termination of the appointment is the last straw that broke the camel's back. Yeah. What other issues, have triggered this, protest?
Okay, you see, the key issue is that we try as much as possible as employees to unionize here so that we will have a better conditions of service for ourselves. Attempts were made to block that. And this thing started about 8 years ago. They didn't want the union to exist. And so what they did was that they will frustrate the process. First, they tried to make sure that we don't get a collective bargaining certificate. Right? So we don't have anything that will guide the relationship between the workers and management. So,
but that sounds a bit, ironic. If you are working at the National Labour Commission, we're supposed to be advocating for unionization, and they are rather stifling, the growth of unions. That's a bit ironic.
Yeah, it's just explain the leadership style of the chairman, who used, in fact, he was the first substantive executive secretary of the commission. The one who came, his predecessor was acting.
The conditions of service, you say it is very appalling.
Yes.
What exactly about it?
Well, as you can see, they asked me on air, what are the grievance procedure? We don't have. Why? There's no law, there's no document that we say that if something should happen, this is how we are going to go about it. We don't have. And so we think that whatever you ask, they will decide to listen to you or not. And so you just come to work and then you go. If we have such policies in place, this transfer issue would have been very smooth to the extent that it wouldn't have come this far. Because the Takrade office is located in the Metropolitan Assembly of Sekandi. Now, this is an old structure which was renovated by the commission. But because of the poor condition of the building, with time, the roof is peeling off.
The entrance is locked right now with its padlock and a huge chain. When are you going to open this office for,
It's very simple. When depends on when the employees will be reinstated and when the workers are convinced that between the workers and management, we have put in place a better conditions of service for the good of all workers in this country.
But you agree with me that that cannot happen in the next 24 hours. That certainly will take some time. So is it assurances that you want, or you want all of these things put in place before you open the office?
Yes, the condition is very simple. If you can take a day to terminate, why does it take you a long time to reinstate?
Now, health facilities in the Upper West region are at their wits' end and unable to buy basic consumables. Some of them even don't have common paracetamol at their pharmacy shops. The reason being the delay by the National Health Insurance Authority to pay claims owed the various health facilities in the region. The NHIA owed 11 months of claims to health facilities in the Upper West region. Some of the health facilities have made frantic efforts to make patients pay for partially treatment, but which was met with stiff resistance from the patient, thus impeding efficient and effective health delivery in the health facilities. Rafiq Salam visited one of such facilities at Jirapa and now reports.
Simple put, medical facilities in the Upper West region are on the verge of collapsing due to the inability of the National Health Insurance Authority, NHIA, to reimburse them claims they owe them for the past 11 months. The St. Joseph's Hospital, located at Graba, is no exception. The NHIA indebtedness to the hospital as of December 2016 stood at 2,510,783.04 Ghana cedis. For the year 2016, they were only paid 90% of their claims for March and April. Since then, they have turned deaf ears to the several appeals made for payments for the succeeding months. Addressing stakeholders at the annual performance review meeting organized by the Graba District Directorate of Health, Medical Director of the St. Joseph Hospital, Dr. Richard Wudaseme, expressed worry over the delay in the reimbursement as it has impeded efficient and effective health delivery to patients at the hospital.
We are in arrears of over 11 to 12 months now. What that means is that it stifles resources that ordinarily would have come to the hospital. And so the hospital are unable to buy very basic consumables. It is not an open secret that nowadays when you come to the hospital, you can't even get paracetamol because we do not have the resources to buy. What we sought to do was, could it be possible that a token could be taken from the clients in such a way that we'll be able to provide the very basic and minimal services that clients would need. But that has often been resisted by the same patients that we serve. So we are only reliant on health insurance. And as I often describe it, the reimbursement from health insurance can best be described as epilepticus and erraticus.
It is not only hospitals here in the region that are caught in the web of the non-payment of the claims by the NHIA, but the district health directorates as well. Phoebe Balogunyentimi is the Graba District Director of Health.
We usually depend on some vertical funder. Some programs like UNICEF could come and say, we want to help in nutrition, we want to help in that. And if we get little funding from nutrition, we integrate all the other activities. Because you can't get some activities virtually have nothing, or programs have nothing. We want to do away with leprosy. Leprosy has no money. You want to do away with meningitis. Meningitis has no money. But these are the things that are bothering you. And so if you bring me money for nutrition, I will use part of it to work on these other areas. And that is where we talk about integration, to make sure that the limited resources or the scarce resources that we have will be used judicially.
Another area of concern for the Graba District Director of Health is the rising cases of teenage pregnancy and unsafe abortion. Reporting for Joy News, Rafiq Salam, Graba.
So watching News Desk on Joy News.